situation and the government think about it.
What are you trying to insinuate? All these people looting Nigeria's money? You think
This is Nigeria Info. Nigeria Info.
Good afternoon and welcome to Mind, Body and Soul on 92.3 Nigeria Info. My name is Sam Chinedu, and as always, we discuss health issues here. It's your weekly health program on radio. Now, this week we'll be continuing from where we stopped last week, or better yet, it's just another session to talk about the same thing, cervical cancer, because it really does seem like the entirety of this month is dedicated to raising awareness on cervical cancer. My guest is Dr. Agogbuo Chika. She's a public health physician, Department of Community Medicine, UPTH. Good day, Dr. Chika.
Good day.
How you doing?
I'm fine, and you?
Wonderful. Thanks for joining us.
Thank you, too.
Now, I know that we have some awareness days or awareness week. Why is cervical cancer taking an entire month?
For cervical cancer to take an entire month, that shows you the importance of it. And most times we don't really get to talk about it in this part of the world, maybe because it concerns women. Okay. So maybe around the world it has now been seen that it really has to be talked about for people to really know. And also because of the way it presents, especially in the early stages, people really have to know.
Okay.
Yeah.
So if we're looking at data, how many women in 100 or in 10, what's the percentage of women that, get cervical cancer?
Okay. According to the last data we have is about 2018. Yeah, globally, about more than 500,000 cases of cervical cancer worldwide. And then in Nigeria, you have about roughly 15,000 cases per year. And then you have up to 10,000 deaths.
Hold on, 15,000 per year?
Per year.
And 10,000 deaths?
Deaths per year.
Oh, then
that's really serious.
That's something.
Yeah.
Okay, so let's start from the top.
Okay.
What is cervical cancer?
Okay. First of all, before we talk about cervical cancer, we need to know what exactly is cancer. Because we've been hearing cancer. Cancer, what is it? Cancer are just abnormal cells that have grown abnormally and have left their place of origin, migrating to other parts of the body, causing diseases, causing infection. So cervical cancer is all about these abnormal cells growing in the cervix or originating from the cervix. The cervix is actually what most people call the neck of the womb or the mouth of the womb. That's the entrance from the vagina into the uterus. And it serves a lot of functions. It's the place that dilates when a woman is giving birth. Women will be conversant with that. Yeah, so that's just, in a nutshell, abnormal growth of cells in the cervix that can migrate to other parts of the body, causing infections, causing diseases.
And cells can grow abnormally to anyone at any time, anywhere?
Yes, anybody can have cancer, but cervical cancer is for women because it's only women that have cervix.
Yeah.
You understand? Yeah.
Oh, damn. All right. So, what causes it? As you've said, it's abnormal cells, but I know that there are risk factors, as you say in your field.
Yeah.
What are the risk factors?
Cervical cancer. Risk factors include the first is actually a virus. That's the commonest cause of cervical cancer. It's a virus, human papilloma virus.
Okay.
This human papilloma virus has several serotypes. It causes a lot of diseases or cancers, not only cervical cancer. But the one that particularly causes cervical cancer is the one with serotype 16 and 18. Yeah, serotype 16 and 18 has been implicated in over 70% of the cases of cervical cancer that we have. Then other risk factors are early sexual activity.
Early?
Yeah.
Okay.
Early sexual activity mainly tied to multiple sexual partners. The human papilloma virus infection is a sexually transmitted infection. So So you get it through sexual intercourse.
Yeah.
So if you're more likely to have it if you have multiple partners. Other risk factors include previous sexually transmitted infections can also predispose you to it. A weakened immune system, maybe from prolonged steroid therapy, or even diseases like HIV/AIDS that weakens your immune system can also predispose you to cervical cancer. Smoking has been implicated. Women who smoke are at higher risk of having cervical cancer. Then multiparity. What we mean by multiparity, so many people are also prone to cervical cancer. And then long-term use of oral contraceptive pills have also been implicated.
It seems that there are diseases reserved for our generation because our mothers and grandmothers had like 12, 15. You know, I know that children were a big part of it. It was almost a bragging right.
Yes, among them then.
We didn't
But
hear of.
were they testing? Were they screening? Were they testing? Some of them could be dying and you don't know the cause of death. So it's not as if it's a new generation thing. It could have been on for a while without being noticed or without anybody actually drawing attention that this death is actually from cervical cancer. This death could actually be from cervical cancer. We just maybe attribute it to any other thing.
Oh, well, but lifestyle changes. Are we, as the clerics would say, living a more wayward life now than our mothers and their mothers before them did?
Okay. I don't know what to put me in a fix, but really, lifestyle changes, as I said, multiple sexual partners predispose you to getting it because you are more likely to get it. And also practicing unsafe sex when you don't use a condom. I've told you that the human papilloma virus is sexually transmitted. So if you are in the habit of practicing unsafe sex, you are also at risk of having it. And also the smoking. Yeah. Smoking is also a lifestyle issue. So if you are smoking, especially over a long period of time, you are also at risk. Because what smoking does is that it alters the cells in your cervix and can predispose you to it.
Now, early sexual activity is one of the things you said before you said multiple sexual partners.
Yeah.
So when you say early, I'm certain someone who's listening is asking, so when is good enough? When is someone ripe enough to start? Because early, you know, you have to kind of put
the early usually ties or goes with multiple sexual partners. Because if you have an early sexual debut, you're more likely to have multiple partners.
To explore?
Yes.
Yeah. Okay. So what are the symptoms? What would a woman begin to feel that tells her it looks like cervical has arrived?
Okay. Initially, one thing with cervical cancer is that it can go on for a long time without being detected and then causes problems over like almost 10 to 20 years. You could have it without knowing. So initially, you could go on without symptoms, thinking you are okay. But when symptoms start, the first things you could notice are irregular bleeding, irregular vaginal bleeding. And this irregular vaginal bleeding could be in the form of intermenstrual bleeding. By intermenstrual bleeding, I mean you're not seeing your period, it's not your time for your period, or you're bleeding in between periods. You've seen your period and you're bleeding again before the next period. It could be a pointer. Post-coital bleeding or post-contact bleeding after intercourse, you're bleeding or spotting. That's one of the symptoms too. And then post-menopausal bleeding. By post-menopause, I mean you have attained menopause. You have stopped seeing your period. Mothers, elderly women, you have stopped seeing your period. And then all of a sudden, you are now bleeding again or you are spotting again. That's also one of them. Then abnormal vaginal discharge. Every woman has a level of vaginal discharge that she considers normal. But when it is abnormal or foul smelling, you should have that checked out. Pain or discomfort in the lower part of your abdomen, pelvic pain, low back pain, can also be a sign of it. Pain during intercourse can be a sign of it. Then in the later stages, we now have things like weight loss, unintended weight loss. Maybe when the cancer has spread, become invasive, you now have unintended weight loss, you have anorexia, you can't eat well, you are generally feeling unwell, and then the likes.
Man, there's no good news on this list. Everything here is either painful, bleeding, or losing. And that's a lot. Now, I know that with most cancers, early detection is, one of the many ways that lives can be saved. Is it true that if you are already feeling something, then it's late?
Not necessarily.
Okay. With cervical
Because
cancer.
What you're feeling might not be cervical cancer.
Now, I'm
But it's
saying,
good to check it out.
as with symptoms, if you're already feeling the symptoms of the cancer, is it late?
It's not. I would say it's late. It depends on at what point
Okay.
we arrest it or at what point it is discovered. I told you it has a long period, a long incubation period of years.
Okay.
So if you're lucky and you get it early, it can. It's one of the cancers that can be prevented and treated when you pick it up at the early stages.
Okay.
So we are lucky that it can be prevented and it can be treated. But in this part of the country, because we don't really go for screening, we don't really go for checks, we tend to pick them late when really nothing can be done.
So 10 to 20 years, that's
A long time.
That's more than a lifetime for some people.
Yeah.
So what does a woman need to do to lower her risk of getting this cancer?
Okay, from the risk factors I mentioned before, or multiple sexual partners, at least be faithful and limit yourself to one sexual partner, or practice safe sex. If you must have sex, safe sex, use a condom. If you're smoking, please, I think it's time to quit. And then other things like screening. Screening is very important. We can catch it early. So there's what we call the pap smear, the perpendicular smear, that can be used to screen for the precancerous stages of the disease.
Okay.
The pap smear is not a cure. It is a screening test, and it picks up the precancerous stages. That's precancerous stages means before, because the cells begin to change over time.
Yeah.
So if we're able to pick them up at those early stages when they're still changing, they can be contained at that time. They can be treated at that time. So pap smear, very important. And we also have what we call visual inspection under acetic acid. With acetic acid, that's another way of testing too. There's also the human papillomavirus test itself that detects the virus. So because the virus has been implicated in almost over 70%, the human papillomavirus has been implicated in almost 70%. So if you're able to pick it up early, then you know that you can also treat.
Now, the virus you said is sexually transmitted,
Yes,
but the cancer is exclusive to women.
it's exclusive to women because
So-
it occurs in the cervix.
How is it that women get the virus from men that do not have cervical cancer?
Okay, if you remember, I said the human papillomavirus has a lot of serotypes. The one that causes cervical cancer is serotype 16 and 18. There are other ones that cause other cancers, penile cancers, anal cancers. We have the 6 and 11 that causes genital warts, which is common to both men and women. So you can have the virus. The men can actually have the virus. And if the woman is unlucky, she now has intercourse with the man that has the serotype 16 and 18, and she gets infected, she could progress to cervical cancer. But not all infections, not all human papillomavirus infections end up in cervical cancer for the women. Yeah.
So the track system, sorry, I call it track.
Serotype.
Stereotype 16 and 18 giving to the woman will give her cervical cancer.
Yes.
But what does it do in the man's body? That's 16 and 18.
It can cause other things like anal cancers.
So wherever it is, it's up to no good.
Yes, exactly.
It's out to steal, kill,
There
and
are
destroy.
so many serotypes that cause
The same
human papillomavirus. But because we are talking about cervical cancer, we are narrowing on the serotype 16 and 18 for cervical cancer.
Well, for obvious reasons, Oracle being Sam Oracle Chinedu, and now I'm curious to know what track 1, track 2, 3, 4, all the way to 16 and 18, what they all do. So it's bad news all along that line.
The virus is just bad news.
Is there any less severe, maybe like 22?
Okay, 6 and 11. We'll call them let's call it the benign type that causes the genital warts.
Okay.
Genital warts are not cancers,
Yeah.
but they are abnormal growths in
Those
the
ones come in
genitals.
peace. 6 and 11. I'll write that down. Okay. So these are the things that women need to do to reduce their chances. I've heard of eating healthy and exercise as an answer to a lot of health problems. Does that apply with cervical cancer?
Yes, your general well-being is important too in any management, in the management of any disease, in the prevention of any disease. So eating healthy, exercise is also for your general well-being. But that doesn't prevent you from getting cervical cancer because the cause is specific. Yes. So.
All right. Now, you've told us about screening, the pap smear, visual inspection, and different types. What kind of screening method is popular here in Nigeria?
Okay, popular among us is the pap smear,
Okay.
the papanicular smear. Any woman, usually above 20, or has you've started sexual intercourse, you should actually screen, get it done. You can get it done at any health facility, tertiary health institutions, secondary institutions, some private laboratories. You can get it done at the University of Port Harcourt Teaching Hospital. And then once it's a screening test, so it is meant to pick up the disease when it's the earlier time when it's occurring. And then if any abnormalities are noticed, you are further investigated.
Okay.
If it ends up being the cancer and we can get it at the early stage, you are treated. There are various modalities of treatment, and once picked early, the success rate is high.
Wonderful. All right, it's Mind, Body and Soul on 92.3 Nigeria Info. Dr. Chika Agogbuo is a public health physician, Department of Community Medicine, UPTH, and she tells us how to stay safe. As much as we need to know about cervical cancer, coming up next, she'll be telling us what has been done and what will still be done in the Cervical Cancer Awareness Month, which just happens to be January. But I'd like to hear from you now. 0817-923-0002. 0817-923-0003. 0817-923-0007. WhatsApp is 080-903-06-416. Please turn off your radio as you call us. Chidi on WhatsApp says, cervical cancer is more than deadly rather. It killed my grandma in 2017. And I watched her in the hospital, passed through serious pain as a result. I'm so sorry to hear that, Chidi. And over to the phone lines. Hello? Hello?
Good afternoon.
Good afternoon.
Yeah, cervical cancer. I think we should have sex with condom. What if someone does not want to use condom on his own bike?
I'm sorry, what if someone does not want protection for who?
For as in meeting his wife, not an outsider.
Okay, meeting his wife.
Yes.
Has that person been meeting some other people besides the wife?
No.
Okay, the person is sure that the wife is the one and only.
One and only. None other, yes.
Does the person know if the wife too?
Yes.
Okay, thank you very much. Doctor? One man, one wife.
One man, one wife. If you have any doubts about your status, you can get screened as a woman. You can go for the pap smear, or you have the HPV test done, the human papillomavirus test. Your husband can also have the test done, the human papillomavirus test.
Really?
And I think that will clear your maybe allay your fears.
No, he's not scared about the
relationship.
fidelity of his wife. He's saying, because of the point you made about sexual partners.
Yes, by using condom, that's when you have multiple sexual partners.
Okay.
Yes, and you're having unprotected intercourse, you are at risk.
But
But
if
if
you
you're
have one partner.
faithful to one partner, you shouldn't have much to fear.
All right. Well, he says faithfulness is the middle name of his family. So hopefully he has nothing to fear. Back to WhatsApp. Ask a guest concerning the talk on cancer. When can we start having sex? At what age? Mr. Henry Woko from Polo is asking. I have a son and daughter, so I need your advice. Doctor, I think this one is up to you. I don't have an answer to this question.
I don't have an answer
You
for
don't?
when you should start having sex. Yeah, the only thing is that early, as they said, early sexual debut predisposes you to having multiple sexual partners. That is where we are pointing at. Multiple sexual partners. If you start sex early, especially teenagers, by the time they start sex, they like to experiment and then have so many partners, and they are at risk of having the human papillomavirus. The more sexual partners you have, the more unprotected intercourse you have, the more risk you are exposed to.
Or you can just behave like your parents and wait till marriage.
Yes.
Yeah, that works perfectly. Hello?
Hello, good afternoon.
Good afternoon.
Okay, I just want to ask the doctor a simple question.
Before you ask, simply turn off your radio.
Okay, just 1 minute. Let me get close to it.
Hold on.
Okay, the
All right.
radio is off now.
Thank you.
Okay, you're welcome. I just want to confirm something from her, the preventive measures she mentioned. She also said that multiple childbirth, that is, a woman has given birth to so many children who can cause cervical cancer. Is that right?
Put her at risk.
Puts her at risk.
Put her at the risk.
Yes. Yes.
So, like, for instance, now I have 5 kids, and my mom is telling me that I should make up to 9.
Wow.
Yeah, she said at least 9 because I'm the only child. Yeah.
Okay.
Yeah, so she said I should make up to 9. So I don't know. Is it trying to make up to 9 kids? Am I putting my wife at risk of cervical cancer? Please, madam, tell me.
I'm more concerned about why what you want does not override what your mom wants. How many kids do you want?
For me, I would have needed only 3.
Yeah, so why are you concerned about 9 that is not your desire?
But sometimes you just go for when your mom tells you something, the Bible says that honor your mother and your father, so that your day will be long.
The Bible does say that.
If I honor my mom and I want to give her what she wishes, and if it's going to be detrimental to my wife's health in the old age, then I think I need to call her to order and tell her this is what medical says. So can we please restructure our thinking or our prospects? It's possible. So I just want to know how many kids maximum will put my wife at risk.
I get you, and I would let the doctor answer, but I think this is a bigger problem on boundaries than using a medical excuse to give your mother. Is it impossible to say I want 3 and I want 5 and that's good enough for me? Would that be too hard to tell your mother?
Sometimes, the kind of motherly role they play in your life, yeah?
I get it.
It will be somewhat disrespectful to tell them eyeball to eyeball that, see, this is what I want. It will look as if, you are just trying to be ego or something. So if I have something, that is something I can show her, or explain, then that will now make me a little bit look, respectful before her, because I owe her a lot of respect. And, man, you know what it means when you have a lovely mother.
Yes, I do. I do know what it means.
Please,
yes.
I want madam to tell me how many kids at least should I.
All right, Dr. Chika, you will have to give him a medical report, else he wouldn't be able to go visit Mama.
Thank you so much for your question. I'm sure you're not the only one in this predicament. There are a lot of people that could be in your shoes. But health first. We preach family planning. Give birth to the number of children that you can cater for. Give birth to the number of children that that financially you can cater for. And then also look at the woman's health. The more a woman undergoes pregnancy, she carries the pregnancy for 9 months, the whole physiological changes that go on in the lady, even during childbirth, recovery and everything. And then you put the woman through so many repeated episodes of this. The body tends to wear out. The body is not a machine, and it will wear out at the end of the day. So please and please, it's what you discuss with your wife, discuss with your mother, discuss with your wife. Come for family planning. We have family planning services at the University of Port Harcourt Teaching Hospital. Come, we'll discuss with you, we'll talk with you, talk with your wife, and then for the health of your family, for the health of your wife, please.
Okay. Thank you very much, Dr. Chika. I'm certain a mother somewhere would hear what you just said.
Yes.
Well, still taking your questions. 0817-923-0002. 0817-923-0003. 0817-923-0007. WhatsApp is 080-903-06416. Cervical cancer is the focus for today. Good afternoon. Please, does cervical cancer prevent a woman from getting pregnant? Oswald from Port Harcourt is asking.
It could.
It could.
It could prevent a woman, especially if it's in the late stages.
Oh, then.
Yes, it could.
But early and mid, she's good.
Early, that's why we hammer on screening. Once you pick it up early, it is cancer, remember? Once you pick it up early, the good thing about cervical cancer is that it can be treated, it can be controlled when picked early.
Okay. Hello, good afternoon. Hello.
Hello, good afternoon.
Good afternoon.
Am I a Nigerian info?
Yes, you are. What's your name?
My name is Ambassador Justice from Omok.
Talk to me.
I've been listening carefully on this cervical cancer of 18 and all that. But there's something I'm trying to ask the doctor there. He talked about multiple sex and all that. So in which junior level or in which primary or secondary level will this begin to affect a man's productivity or a man's body system?
No, hold on. I feel like, what's your question specifically? Are you saying when it's too early or when you can start or stop? I'm trying to get...
Okay. When does one begin to notice such in the body system?
Notice what?
Is it talking of symptoms, maybe?
I think the sexual debut, point you made is what hits a lot of people hard. And
but as I try to explain, it's just because the earlier you start intercourse, the more you are likely to have multiple partners. And you might not have multiple. What I mean by multiple partners, you might not have the multiple partners at once.
At one time, yeah.
Yeah. Over the years, over the times, you're changing partners, yes.
It's like a record.
Along the line, you pick up the virus.
Okay. Hello?
Hello, good afternoon.
Good afternoon.
Yeah, my name is Yuji.
Talk to me.
Okay, now, I want to ask, specifically, is this only true sexual intercourse, so to speak, that is gotten? Because now hearing that some old persons have this cervical cancer, I'm beginning to, like, the corner that called, sorry for using that example, said the mother. So the grandmother, I'm not like, she has more than one partner.
Okay.
And if it's not restricted to, if it's only restricted to sex, that means some of us who shouldn't bother about our mom or our grandmother taking them for screening.
All right. That's a very good question.
Okay. Thank you.
Doctor?
Thank you very much for that question. If you can remember, I said it has a very long incubation period. It is slowly growing. It has a long incubation period. So it could manifest later on. That's why you're hearing of maybe older persons having it. It could manifest later on. Does not mean that it's because the elderly woman is engaging in multiple intercourse at that point. It has had a slow progression over the years and maybe was only detected at that point.
Okay. Yeah. But that thing is kind of hard for me to pronounce. Human papilloma
virus.
Human papilloma. Sounds
HPV
like
in short.
All right, so let's work with HPV.
Okay.
The full thing sounds like a nickname. So HPV, is it exclusively sexually transmitted? Is there any other way to get it besides intercourse?
Most times it's from intercourse, especially that serotype 16 and 18 that we talked about.
Okay, so most times. So
yes,
the other times, what's the mode of transmission?
Most times it has just been implicated as being sexually transmitted.
Okay.
Yeah.
The guest is emphasizing on the woman sticking to a partner. I'm not sure I got that from what she said. Of course, the cancer affects women, so that's why it looks like, she's talking more to women. But no, faithfulness is for everyone. Forgetting that men carry the virus. Anyways, moving on. She said contraceptive can be a risk factor to cervical cancer. Someone just called to ask how many children will expose his wife. Okay, and then she asked the guy to opt for family planning. Is that not contradictory, doctor?
Okay, let me address the contraceptive use I talked about. Long-term use of oral contraceptive pills.
Okay.
Not just all contraceptives.
Long
oral
term.
Contraceptive pills, long-term use of it has been implicated in cervical cancer.
So when we say long term, are we talking 5-10 years?
Over 10 years of it.
Okay.
Yeah. Okay, so the next question, please. If I can get
Yeah, well, she talked about, the contraceptive thing, and, the person who asked about the kids, you
Okay,
gave,
that's family planning.
yeah, you gave your family planning as
Okay.
an option, so
Okay.
we're saying whether
I
it was
mentioned
contradictory.
contraceptive pills, long-term use of it. There are so many contraceptive methods, so many family planning methods that you can use. So talk with your healthcare provider, and the suitable method for you.
Does the virus affect a man's fertility?
Oh.
That should be the HPV. A man
HPV.
who has that.
It's good in the long run. It's good. There's
Okay.
a possibility. It's good. Yeah.
All right.
Since I also remember that I said it causes so many other cancers.
Yeah.
In the men, you can have the penile cancers, the anal cancers, and also remember the serotype 6 and 11 that causes the genital warts.
Warts, yeah.
That's so common. Yeah.
So 1 to 16, which we're still trying to deal with. Hello? Please turn off your radio.
Hello?
Good afternoon.
Hello? Yeah. I want to find out from the doctor there, although I start listening late, I want to find out if infection can stop someone's period. If infection is qualified to stop someone not to have a period in
Okay.
a period of almost 2 months.
Okay. Can you prevent a woman from seeing her period? All right, doctor.
Okay. Thank you. The word infection, you didn't specify what exactly.
He's talking
you
about
mean
cervical
by-
cancer, obviously.
Okay, yes. As I said, other sexually transmitted infections too can predispose you to having cervical cancer. Other ones, HIV, I mentioned it, can predispose you to it. So the thing about infection, or when you think you have an infection, is to get it checked out. Go to the doctor, go to the hospital, get it investigated and treated properly. That abnormal period, that abnormal vaginal discharge could just be cervical cancer.
Yeah, but you see, when you talked about bleeding, most of the points were along the lines of bleeding more than usual.
Not necessarily.
Postcoital bleeding,
Postcoital,
menopausal bleeding.
And the intermenstrual, that's bleeding in between.
Yeah,
periods.
so that's more blood. He's saying, can it stop a woman from bleeding? Talking about less blood, of course.
Okay.
Yeah, so if a woman has the cancer, could it affect her not seeing a period for over a month?
Okay, maybe in the later stages of it. But the woman should actually, once you have noticed anything abnormal in your body, get it checked out.
Okay.
Yeah.
So let's talk more about screening. How frequently should a woman do this?
Okay, as I said before, at the age of 20, 21, if you're sexually active, you should actually start screening. And if you have a normal test, it's advised that you repeat every 3 years.
3 years.
Every 3 years.
Okay.
If it's abnormal, you are further investigated. Other tests are done to determine actually.
Is there a vaccine?
Yeah. The good news, as I said, is that it can be prevented. It's one of the cancers that can be prevented and can be treated if gotten early. Prevention, there's actually a vaccine that can prevent it. Specific, there are two types of vaccines.
Okay.
One that can be given to only women, and the one that can be received by both women and men.
Okay.
Yeah. So we have the Cervarix that's given to only women, and Gardasil for now that can be given to women and men.
And
So-
this is to stop men from giving their wives this
To
virus?
stop you from getting the infection.
Or getting the infection?
Yes, from getting infected. It doesn't cure. Please, it doesn't cure the human papillomavirus infection. So if you have it already, the vaccine is not going to cure your infection.
It's
If you
just-
have cervical cancer, the vaccine is not going to cure your cervical cancer. It only prevents you from
doing
getting infected.
more damage?
Yes, prevents you from getting infected.
Okay.
Ab initio.
All right.
And that's why we advocate that it's given early. Early. It's a vaccine that we give early enough to children, preteens, usually from the age of 11, 12, sometimes up to 9 years.
Yeah.
You give them, and then they are protected.
That's for the girls, right?
For the girls, yes.
And the men, the
the
guys?
The boys too can get the Gardasil between the ages of 11 and 12 years.
That early?
Yes.
Wow, we're already preparing this guy for the future.
Prevention is better than cure.
It is, but I mean, trying to give my son a vaccine at that age. All right. cervical cancer is the focus. Now, of course, the good doctor will be telling us shortly how far they have gone with the awareness for this month. And we have about 3 days left, 3 or 4 days. I know that January ends on Sunday. That's as much as we have to raise awareness. What still has to be done with the little time that we have? Please, how many children puts the woman at risk of this cancer? This question keeps coming back, doctor. So is there a limit, say from 2, 3, anything 4, 5 above, you're at risk? You want to put a figure to that?
It depends on you. It depends on your family, you and your wife. That's what we do when we come for the family planning counseling sessions. We talk to you, we talk to your wife, because after we have given you all the information, it is now left to you to make an informed decision.
Yeah, but doctor, people would like a figure. I mean, somebody called and said he has 5, and by the grace of God, if his mother wins the battle,
he goes up to 9.
He will have to go to 9. So
for the sake
those
of
are
the woman's
specific
health.
figures.
Yeah.
So how many are we looking at?
If you have 3, I don't think you should go more than that. But it all depends on you and what you want.
What you want.
We just give you the information and you make your decision.
Okay.
Yeah.
0817-923-0002. 0817-923-0003. 0817-923-0007. Remember, we have a female dedicated line. Reports reaching me from reliable sources. Researchers and experts have discovered that more men are calling, and we're asking where the women are. So, women, you have your own line. 0817-923-0009. WhatsApp is 080-903-06416. Please turn off your radio. Does HPV have a vaccine? Yes, the doctor just answered that. Good day, doctor. Is it good for a pregnant woman to have sex? Wow, that does not connect to this conversation. You want to quickly give a yes or no?
Nothing prevents a pregnant woman from having sex if there are no other medical contraindications to that.
Okay. Hello? Hello? Anybody home? Adam. Okay. Thank you for saying nothing. So, doctor, what has happened so far with the awareness in January?
Okay. A lot of awareness has gone on concerning cervical cancer. Remember, it's not only for this year. It's been on over the years.
Okay.
The whole month of January is dedicated to telling people about cervical cancer, to informing people, going into the rural areas, telling them, because they are the ones that we need the information to get to the grassroots.
That's right.
So a lot of programs have been going on, people going into the rural areas, giving talks on radio, giving talks on television, talking about it generally, telling people that this cancer is preventable, this cancer is treatable. You can actually telling people where facilities, that's the facilities available where you can go and get tested, the facilities available where you can get the vaccination, and then just generally hyping it, telling the whole world that this cervical cancer is real and that we can actually reduce our figures.
Now, have there been any drive testing? I understand that M1 is doing something.
Yeah, Medical Women Association, I think they've been going around doing some tests and also organizing for vaccination.
Okay. So for, the remaining parts of the month, today is Thursday the 28th. We have Friday, Saturday, and Sunday. Are there any specific events that will cover these remaining days?
It's still all about the awareness. We could have more radio talks, more TV talks, more rural visits, and then more awareness generally.
Okay. Now let's go back to the phone lines. Hello?
Hello.
Good afternoon. Good afternoon. How you doing?
Fine.
Where have you been? Go ahead.
Yes. So please, I want to ask the doctor if the cancer comes through multiple strands or too much sex. That's what I want to know.
Can you ask the question again? I don't think she heard you.
So the cancer comes through multiple strands into the body. Can you hear me?
Yes.
Yes.
Or too much sex. But
Okay.
some guys can have like 3 rounds a day.
Yeah.
In night.
I think we get it.
Okay.
Doctor?
So the cancer comes from the virus, the human papilloma, being infected with the human papilloma virus, which is sexually transmitted. So multiple sex Are you talking of multiple sex with the same person or multiple sexual partners?
Yeah, well, I think that her question borders on using protection.
Yes.
So if you have multiple sexual partners and you're smart enough to protect yourself, do you still stand a greater risk? So she wants to know if it's the activity,
okay,
that leads to it, or
yeah, multiple sexual partners. If you must have multiple sexual partners, please use a condom.
All right.
Consistently.
Okay.
Please.
Hello. 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 Okay. You have to call back because I could not hear you. Hello.
Hello.
Good afternoon.
Yeah, good afternoon.
Afternoon.
I have a question for the doctor.
Go ahead.
And I don't know, when I delivered my baby during this pandemic at BMH, they said the cervical cancer is normally 6 months after birth. But when we got there, they refused to do it because of, I don't know if it's late. My baby is 7 months now.
Okay.
It's not late, madam.
If I can still go, I
can
delivered
still-
through CS.
No problem. You can still go and get it.
I can still go.
Yes,
right?
please. Yes.
All right. Thank you for that. Dr. Chika did not raise that earlier, so thanks for bringing it to attention. 6 months after birth, what you want to tell us what that is?
That's the postpartum period. That's the postpartum is 6 weeks after birth.
Okay.
But usually after a woman has given birth, has delivered, and then we give time for the body to return to its previous physiologic state, it's
Okay.
good to just do the test, do the screening test, and check it out.
So hold on, it takes a woman 6 months to return to
6
her.
weeks, please, not
Oh,
6
weeks?
months. Yes.
Okay,
The
yeah.
postpartum period is 6 weeks.
Well, that
Yeah,
does
6
feel
months,
better
yeah.
because 6 months is half a year.
Yeah.
Hello.
Hello, good afternoon.
Good afternoon.
My name is Dennis, calling from Port Harcourt.
Talk to me, Dennis.
Please, I want to know two things
All right.
from the doctor.
Hmm.
One, can a woman contact this human papillosis, blah, 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 that causes cervical cancer through oral sex? That is one.
Oh my goodness.
Then number two, is it heritable? That is like, like through the genes. Like
Yeah.
you said, Parkinson is hereditary disease, blah, 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 blah. I want to know if this disease also can be heritable.
Yeah, if it's genetic. Doctor.
Okay, it's not hereditary. Human papillomavirus is not hereditary. So that's to answer that your question. And then the question of oral sex, there could be a possibility because the human papillomavirus has also been implicated in head and neck cancers.
Okay.
Yeah, there's some serotypes that have been implicated in head and neck cancers. So oral sex could just be a possibility.
I'm sure you wish at this point that sex was not a factor because it seems to be the most important.
That is the major. This human papillomavirus is the major
Yeah.
cause of it.
If there was a way you could talk to HPV to be contracted in other ways. People are interested in the activity. Hello.
Hello.
Good afternoon.
Yeah, good afternoon.
Go ahead.
My question is, can a guy contract this virus? And if yes, what are the symptoms?
Okay.
And what part of the body can it manifest? That's my question.
All right. Well, she's answered that before. I'll still let her do that. The guy can have the virus, but it will not translate to cervical cancer.
Yes, because the guy
for
doesn't
him.
have the cervix. It's only women that have cervix. That's why we say cervical cancer and women. Yeah, but there are also other diseases or other cancers that the man can have. He can have the penile cancers, that's the cancer of the penis. He can have the anal cancers, and also even other non-cancerous growths like the warts, genital warts.
I've always heard that we don't have enough doctors, Dr. Chika. I feel like doing this show for a couple of years, I might start taking patients. Yeah, I will get to that point. Hello?
Hello, Doyle. Good afternoon.
It's Sam. Good afternoon.
Yeah, Sam. Sorry. Good afternoon.
Good afternoon.
Please, I just have a few questions and a clarification from your guest, your doctor in the studio.
All right.
Please, a woman that gives birth to CS and for, let me say, 7 months today, she's still breastfeeding the baby and her monthly flow is not yet out. Please, is there any sign of infection or what to it?
Okay.
Thank you.
She's still breastfeeding and then she's not seeing her monthly flow. It could just be normal because breastfeeding itself, there's what we call lactational amenorrhea that occurs when a woman that is breastfeeding, especially exclusive breastfeeding. It could also cause the period not to come out. So it's not something to worry about, but you can also go to the hospital, go to your gynecologist, and then get yourself checked. But I don't think it's something to worry about, as the woman is still breastfeeding. It's not an abnormal thing since she's still breastfeeding.
Now I'm thinking all the questions attached to that question. So how long should you start to worry? Because at 7 months, you said he could check with the gynecologist. So how long are you expected to wait for?
Every woman is different. Every woman comes back from pregnancy in different ways or returns differently. The way I will respond, so women, 1 month after delivery, they're already seeing their periods. That's not abnormal too. So it depends on your own physiological makeup.
So for
if
those,
you're worried,
you
should go to your gynecologist and then just get checked up. And then most times it's just okay.
You're sure there's no time that feels out of place? I mean, I've heard of some women that breastfed for 2 years. If she does that for 2 years and it hasn't come, shouldn't anybody be scared?
Yeah, she should go and get checked.
Okay.
But exclusive breastfeeding, you can have that scenario. It's not abnormal. Yeah.
All right. And what must be our final call? Good afternoon. Hello.
Hello.
Good afternoon.
Good afternoon, Sam.
What's your name?
My name is Chidara.
All right, go ahead, Chidara.
Please, me and my wife, we have 3 kids. We have 3 girls. So we are trying to have another kid, a boy.
Okay.
When I'm making love with my wife, we always experience pain. I want to ask the doctor whether it is a sign of cervical.
It's not. Your line is not clear, so I need to know. Did you get the question?
See, my wife also experienced pain when we are making love.
Okay.
I want to ask
if it's a sign. Yeah, so he has 3 daughters, I believe he said. He's trying to get a son, and sexual activity is painful for his wife. Is that a sign?
Of an infection?
Yes, of cervical cancer.
As I mentioned before, pain during intercourse could be one of the signs. But pain, that you have pain during intercourse, does not tag it as cervical cancer. You're not supposed to have pain during intercourse. So if you do, check with your doctor. Go for a checkup and just get checked and know what is wrong with you.
All right.
Yeah.
Well, doctor, thank you for your time. It's been quite the conversation. Any final words as to how we must stay safe against this enemy known as HPV, which presents itself in 18 different forms?
So many, over 100. We've just
over 100?
Oh
my goodness.
Stereotypes of it.
Wow.
All right. So thank you very much, listeners. This is Cervical Cancer Awareness Month. We're just raising awareness on cervical cancer. It's not a new disease. It has been there over time. It's just that we have not been checking. We have not been screening. So it's to raise awareness. Please, any woman above 20 years of age, sexually active, go for your pap smear, go for your screening. And the vaccines are available. Visit your health facility, talk to your doctor, talk to your healthcare provider, and get vaccinated.
All right.
Together, we can prevent this disease. The good news is that it is preventable and it is curable if picked up early.
Dr. Chika, do you enjoy the wonders of social media?
Wow. Great.
Would you like to share your handles? Facebook, Twitter, Instagram?
Okay, Chika Okoye Agogbuo on Facebook.
On Facebook?
Yeah.
Okay, and that's good enough.
That's it.
Thank you very much for your time. Have yourself a beautiful day.
And you too.
And
Thank you.
thanks to you for being around for the Media Dialogue. Of course, Dio comes in at 3, which is in 2 minutes for your hard facts. The conversation does not end on radio. It continues online. And so to be a part of that, at Nigeria Info PH is how you can connect with us on all platforms. You can also connect with me at Sparkling Oracle on all platforms. Have yourself a terrific Thursday.